Welcome to another episode of Cutting Edge Health. If you haven't met, I'm Dr. Orlando Landrum. I'm a physician that helps patients understand their options for being able to treat and improve their condition, whatever it might be. Today, we're talking about stem cells and how stem cell can be used for spinal issues, whether it's pain or dysfunction, and what's coming down the pike that's new and innovative, particularly in 2024. There's two different papers that we've looked at that are going to be really the integral pieces for us understanding how stem cells are different, how they work, and what might be able to make them better. So the first paper is a paper called Biologics in Interventional Spinal Procedure. And the second paper is a paper that's called Applications of 3D, Bioprinting, and Tissue Engineering in Regenerative Medicine, both of which are a heck of a mouthful. But as always, we're going to break it down so people can be able to understand, get it, and really be able to walk away with knowing that there's a reason to be excited and there are reasons to be able to make things feel better. All right, so with that, let's talk about the aspect of stem cells, how it all kind of comes together, and how this can be useful to someone like yourself or someone you care about. So when we look at stem cells as a whole, we talk about those cells being able to be placed in an area that hopefully can use an improvement in healing, right? So this picture gives a picture of what might be able to be done both before as after in order to make things potentially better. So we talk about putting cells there and seeing if they can be able to improve tissue that's damaged and hopefully be able to improve self-repair. There's a lot of different ways to be able to look at cells, but one of the things that we talk about is can we augment that or make it better by improving potentially the diet or being able to add different things to the cells so that they're better? Can we make sure that where we place them using localization techniques puts them in the best, most optimal place so you can get a response? So if we're to do stem cell type therapy, how does that potentially work? So let's say that you take a look at those cellular components, what they can differentiate, meaning what they can become, or a whole host of different types of tissue, everything from blood cells to muscle to cartilage to nerve cells to liver and other things along those lines. And so when we know that that's in place, how can we make that be more useful to us? So currently, when we look at autologous cells, meaning we're taking cells from that person and then placing them back into the same area, historically, we cannot be able to manipulate those cells here in the United States. However, outside of the States, there are ways to be able to isolate those cells, and you can see in this bottom picture something that's called cell expansion and differentiation to different lineages like bone, cartilage, and adipose. And that's actually being done. It's not Star Trek. It's not sci-fi in terms of these things taking place. There are actually things that are taking place outside the States where you're able to take autologous cells coming from that person, expand them to a certain amount, which we've talked about in some other lectures, and then be able to place them back in an area where they are able to have improvement. The most common conversation about this is for that of cartilage. So we think about that for knee cartilage, for hip cartilage, sometimes for the cartilage that's present in the joints of our back. And this picture gives a representation on the left-hand side in pink of what cartilage kind of looks like. But then if you look over to these other columns on the right-hand sides, you can see these different looking pictures that look differently in terms of the cartilage, how it's organized, what are the aspects of the matrices that are associated with it. And those things are pretty complex. So when we look at cells, how do they deal with all that? How can they make that work? We're going to speak specifically in this particular context about the spine. And we're going to talk about two different areas. One, the spinal cord, and two, areas that are associated in and around the cord. So when we look at that first paper, that paper talks about spinal cord injuries, and it notes that anywhere from 250 to 500,000 people have a spinal cord injury every year, and 90% of that is because of trauma. Of those, 12% die on the scene within the first 3 hours, and 48% die within the first 7 days. And so afterwards, the level of functionality can be grossly impaired. And there are people who are actively looking at, can stem cells be able to impact this? I know when we look at this in the area of those providers that deal with this type of treatment, most are very cautious with being able to have this discussion, because they don't want to promise something and not be able to deliver. Currently, at this point in time, we're not able to use cell lineages to be able to improve someone who's had a transfixation of the cord, be able to get them to do a whole host of different things. And those people who promise that really aren't being honest with patients or people who are coming to try to get further insight. So let's be clear. That type of technology and impact is still on the horizon. It's not here as of yet, but we're getting closer to be able to do things that can be impactful. The other area is to be able to look at intervertebral discs. So the areas that separate in between the areas of the cartilage or the bone that then are able to be utilized to be impacted in different ways. And that disc, as we've talked about in other talks, has different matrices that make it. There's an area that sits annularly around the area, and then there's a central area that's the central nucleus pulposus, and they're different in terms of the cartilage that's present for both. At the end of the day, one of the things that we see is that can be really kind of a major challenge is that when we put cells in different areas, the retention and survival can be incredibly challenging. However, that's not the case for every area that's injected, and there are ways that can be improved upon in order to make this better. So one of the things that we're looking at is the utilization of something that's called a collagen scaffold. And if you take a look at this, you can see that towards the lower 1/3 of this, where you start saying, can we put cells in the area that helps keep those cells in the place of where they were originally placed, whether that was injection or other methods, in order to be able to improve the overall outcome for patients? And what we're seeing is yes. And that scaffolding can be hugely impactful to the outcome. So let's say that you were dealing with the knee and you took autologous cells from the iliac crest and you placed them at the aspect of the knee. Perhaps you got maybe 30%, if we're lucky, attachment to the areas that were important. But using a scaffold, meaning an area where you can place those cells to then connect, you may be able to get 70% of that adhesion. And because you have that adhesion, you have healing factors that are then able to then make a bigger impact. Those are the things that we're talking about. When we talk about tissue engineering and bioprinting, those things 5 years or so ago were kind of like, well, who really is making that type of impact? And now we're starting to see things that are different. And so one of the things that you see is like this breakdown of pre-processing, processing, and post-processing. So pre-processing is where you take imaging like a CT scan or MRI. You then use different modeling methods to then put that into 3D. And then you then use different types of bioprinting to occur. And so we're going to talk about some of these different things. And I know the fancy names are a little bit off-putting, like inkjet and extrusion and laser and bioprinting. But at the end of the day, we take this printing of the scaffold, and then we use that to then be able to place and make it much more optimal. So what does this look like pictorially? You have this imaging process that takes place. You have this 3D modeling that's there, and then you're able to then take the harvest of the cells, and outside of the States, again, be clear, they're able to culture those cells and then place them in the area where you can then make them have a better fit and application to the person in order to be able to get a better response. So what does that look like if we're talking about this in depth and detail? What it looks like is the following. So you have that syringe that's in place, you have this piston that's there, you have this printed area that has this cross-linked area, which is that matrices that we talked about before with a printed surface, and you're then able to put cells into those areas. And these are the different types of printing assays that are in place, right? Where you can have everything from this piezoelectric with the thermal component of bioprinting, inkjet printing, laser-assisted extrusion, and at the end of the day, those things can impact things and get outputs that look like this. So if you take a look at 3D printed tissues, you can have like a heart, blood vessel, ovarian cells, bladder, bone, skin, ear that you can see represented here in G, cornea, and those type of things are not just abstract, but really are starting to push the envelope of saying, how can we impact this in a different way than us having to do a surgical treatment that is not autologous, it's not coming from cellular, but it's actually xenophobic, right? Or areas that are coming from a different area. So highlighted here, you can see that one paper talked about patients that had spinal cord injuries, and they had these type of treatments, and they looked at 670 patients. And what they're able to see, now remember, we have to kind of look at this from modest results, is that there was an improvement in motor, but they were able to be, they were found, that there was some motor and activities of daily living that had some degree of improvement, and the sensory score was somewhat better when they comprised this over a number of different analyses. And then when they looked at different treatments with the disc, they saw that 11 patients who had degenerative disc disease and had this implantation, that they had improvement over a number of visits, and they saw the autologous cells were able to be expanded with no outcomes that were bad, no adverse events, and they saw that there was improvements in functionality as well as pain relief. And so in conclusion, what we're able to say is that you can see that there's a change in just doing regenerative medicine with these cells. MSC stands for mesenchymal stem cells, and that you're able now with these matrices that can be able to be developed to have an increase in the number of cells that are adhering, with the result in increase in healing and regeneration. And those things are what are starting to be able to kind of look uniquely at how can we be able to improve our outcomes where we weren't able to do that before. For those of you who are joining us new, we really appreciate you tuning in. If you find a video like this interesting, please hit the like and subscribe button so you can find other videos like this in the future, because we'd love to be able to kind of help you understand your options and help you know how to be able to punch pain in the face, whether it's physical or mental, and get back to leading the life that you deserve. Thank you so much and have a great day.